Drug overdose deaths continue to increase in the United States, and the rise is being fueled by opioids. From 1999 to 2016, more than 630,000 people died from a drug overdose. In 2016, drug overdose became the leading cause of injury-related death in the U.S. Of those deaths, about 66% involved a prescription or illicit opioid painkiller. The Centers for Disease Control and Prevention has launched a major initiative to curb opioid abuse by revising prescription guidelines for physicians, more tightly monitoring pharmacies, and providing more treatment options. CDC Director Dr. Robert Redfield says another important step has been the improvement of data collection.
When I became CDC Director, one of the first areas that I asked to be briefed on was the opioid epidemic. And it was in early April, and they presented me data. And at the end, I asked what the data was up through, and they said March 2015. And I said, you know, I'm a CDC director, but I didn't know I was becoming a medical historian. I really wanted to see data more in real time.
Because of changes in the way data is now collected, Redfield says the states are getting information on opioid incidents within 48 hours. The CDC is also focused on the link between opioid abuse and infectious diseases like HIV.
Many of you probably remember the Scott County example in southern Indiana, where very rapidly, due to basically a group of individuals that were involved in intravenous drug abuse, very rapidly 233 people developed HIV infection, 90% co-infection with hepatitis C. It turned out that 5% of the population in this rural area became HIV infected.
Redfield says the opioid epidemic threatens progress that has been made in dealing with infectious diseases, which makes confronting the epidemic and reducing it vital to public health. Philip Connors, RX 411 News.